Doctors, what was a 1 in a million case that you personally witnessed? I've been practicing dentistry for over 20 years, and you learn to recognize when someone is drowning. Not literally drowning, but that look people get when they're in over their head and fighting just to keep breathing. Sarah, my dental assistant, had that look for months. Sarah was one of those people who made everyone's day better just by showing up. She'd been with my practice for 3 years. Always early, always smiling, always ready with some story about her daughter Emma's latest adventure. Emma was her world, this bright, energetic 3-year-old who would sometimes come to the office after daycare and charm every patient in the waiting room. But starting in the spring, Sarah began showing up to work looking like she hadn't slept in weeks. Dark circles under her eyes, that brittle smile people wear when they're trying to hold it together. She'd apologize for being distracted, for forgetting to order supplies, for spacing out during procedures. Finally, I pulled her aside after a particularly rough day, where she'd nearly burst into tears while sterilizing instruments. Sarah, what's going on? You know you can talk to me. That's when everything came pouring out. Emma had been getting these awful ulcers in her genital area for the past 4 months. Not just 1 or 2. Clusters of painful, recurring sores that would heal and then come back worse than before. Sarah had taken her to their pediatrician, Dr. Martinez, who immediately referred them to a specialist. The first specialist took one look at the location and pattern of the ulcers and made what seemed like a logical assumption. Child Protective Services was called before Sarah even left the office. They think someone's been hurting her, Sarah whispered, tears streaming down her face. They think I'm letting someone abuse my baby. The CPS investigation was thorough and invasive. Social workers interviewed Emma, examined their home, questioned Sarah's boyfriend Mike, looked into everyone who had regular contact with the child. Meanwhile, Emma kept getting sicker. The ulcers weren't responding to typical treatments, and new symptoms were appearing: mouth sores, fatigue, joint pain that had her limping some mornings. Sarah brought Emma to specialist after specialist. Each one ran the same tests, asked the same questions, and came to the same conclusion. A 3-year-old with recurring genital ulcers meant sexual abuse. The fact that no physical evidence of abuse was found didn't matter. They insisted that the medical presentation was classic for what they were looking for. 3 different CPS investigations, 3 different social workers scrutinizing every aspect of Sarah's life. Emma was interviewed by forensic specialists, subjected to exam after exam, all while the ulcers kept coming back. I feel like I'm losing my mind, Sarah told me during one of our lunch breaks. I know something's wrong with her, but nobody will listen to me. They just keep looking at me like I'm this monster who's letting someone hurt my child. She'd started bringing medical journals to work, printing out articles during her breaks, desperate to find answers that the doctors weren't providing. One afternoon, she showed me photos that Emma's current doctor had taken for documentation. I'm not a physician, but I'd seen enough oral pathology in my dental practice to recognize certain patterns. Sarah, I said carefully, have any of the doctors mentioned Behçet's disease? She looked at me blankly. What's that? I pulled up some information on my computer. Behçet's disease, a rare autoimmune condition that causes recurrent oral and genital ulcers, along with other systemic symptoms. The genital ulcers looked exactly like what I was seeing in Emma's photos. You need to ask them to test for this, I said, printing out the diagnostic criteria. Sarah's face lit up with the first real hope I'd seen from her in months. Do you really think this could be it? The next day, she took the information to Dr. Martinez, who dismissed it immediately. She's too young for Behçet's, he said. We typically don't see onset until the teenage years at the earliest. Sarah pushed back, armed with research she'd done online. She found case studies of pediatric Behçet's, rare but documented. Dr. Martinez referred her to another specialist, who also refused to consider the diagnosis. They keep saying she's too young, Sarah told me, frustrated. But what if she's not? What if this is exactly what it is, and they're just not looking for it because it's unusual? It took 4 more doctors before Sarah found Dr. Rebecca Chen, a pediatric rheumatologist at Children's Hospital who was willing to listen. Dr. Chen reviewed Emma's entire medical history, examined the patterns of her symptoms, and ordered the appropriate blood work. The diagnosis came back positive. Emma had Behçet's disease, one of the youngest documented cases of pediatric onset the hospital had seen. I've never been so happy to have my child diagnosed with a chronic autoimmune disease, Sarah said through tears when she called to tell me the news. At least now we know what we're fighting. With the proper diagnosis came proper treatment. Anti-inflammatory medications, immune suppressants, a comprehensive care plan that actually addressed Emma's symptoms instead of treating them as evidence of abuse. The CPS cases were closed. The cloud of suspicion that had been hanging over Sarah's family for 8 months finally lifted. Emma responded well to treatment. The ulcers became manageable, the joint pain improved, and she started acting like a normal 3-year-old again. Sarah got her smile back too, the real one, not the brittle version she'd been wearing for so long. Dr. Chen later told Sarah that Emma's case would be written up for a medical journal. At 3 years old, she was among the youngest patients ever diagnosed with Behçet's disease in the United States. The case would help other doctors recognize that this condition, while rare, could present much earlier than previously thought. Sarah still works for my practice. Emma's 8 now, managing her condition well with medication and regular monitoring. Sometimes she still comes to the office after school, still charming everyone she meets. But now when she talks about wanting to be a doctor when she grows up, Sarah and I both know she's already helped advance medical knowledge in her own small way.